Hi, everyone. I hope that you're doing well. My name is Sarah Touey, Director of Marketing for the Syracuse Community Center Collaborative. This will serve as my 20-second video update spanning key information and numbers from Monday, August 31st to today, Tuesday, September 8th. Starting off with key numbers, Onondaga County currently has 3,853 confirmed cases, 171 active cases, and 201,465 tests completed since March 16th. In Oswego County, there's 322 confirmed cases, 35 active cases, and 38,666 tests completed. In Cuyahoga County, there's 176 confirmed cases, 37 active cases, and 29,736 tests completed. In Delaware County, there's 114 confirmed cases, 102 recoveries, and 15,192 tests completed. In New York State, there's 440,021 confirmed cases and 8,855,109 tests completed. In the United States, there's 6,301,451 confirmed cases, 2,333,551 recoveries, and 83,426,990 tests completed. Worldwide, there's 27,356,706 confirmed cases and 18,351,842 recoveries. Transitioning to updates, as you may be aware, on Thursday of last week, Ernie Davis, a residence hall on Syracuse University's campus, ordered students to quarantine upon COVID being detected in the wastewater system. Students were asked to return and remain in their rooms as testing was conducted. Upon testing the 200 students, it was confirmed that the traces in the sewage system were due to previously detected cases and no new cases were found. A similar instance occurred in another residence hall on campus, Sadler. No new cases were found in that residence hall either. The university has reported 1 new case since Friday on campus and 2 active cases. This week's travel advisory list additions include Delaware, Maryland, Ohio, and West Virginia. Again, the additions to the New York State travel advisory list are Delaware, Maryland, Ohio, and West Virginia. The removals are Puerto Rico and the United States Virgin Islands. So the full list is Alabama, Alaska, Arkansas, California, Delaware, Florida, Georgia, Guam, Hawaii, Idaho, Illinois, Indiana, Iowa, Kansas, Kentucky, Louisiana, Maryland, Minnesota, Mississippi, Missouri, Montana, Nebraska, Nevada, North Carolina, North Dakota, Oklahoma, Ohio, South Carolina, South Dakota, Tennessee, Texas, Utah, Virginia, West Virginia, and Wisconsin. As a reminder, if you're returning to any of those states, you are required by law to quarantine for a full 2 weeks and fill out an online traveler's health form upon return to the state of New York. Last Monday, the CDC, the Center for Disease Control, provided further data on the overall death count due to coronavirus in the United States. Initial findings have indicated that 94% of deaths from COVID-19 also had underlying health conditions. We're seeing obesity really as a staggering underlying health condition for many individuals who contract the virus and become seriously ill or unfortunately pass away from the virus. While 6% of our death count only died from just COVID. So they had no underlying health conditions that contributed to them becoming seriously ill or passing once they contracted the virus. So this initial report led to a lot of confusion. I know many interpreted, the death toll being reported as inaccurate. As of that report last week, we had over 180,000 Americans who have passed as a result of COVID-19. That number has not changed, and the CDC has since issued clarifying language around that. In fact, we have unfortunately lost to date right now 189,221 Americans to the virus. We are seeing, though, from last week's data that 94% of those also had an underlying health condition. But in no way does this mitigate the spread of the virus. The virus is still very much present in our community. We have been hearing about underlying health conditions from the very beginning. Admiral Jouar, Dr. Fauci, Dr. Hahn, Dr. Redfield, Dr. Birx, the U.S. Surgeon General, have all discussed that unfortunately those who have underlying health conditions and who are immunocompromised tend to have a higher risk once they contract the virus of becoming seriously ill or passing away. And we're seeing initial data show that, but in no way do they want you or anyone to interpret this as a pass to stop wearing your mask, stop social distancing, and stop practicing good hand hygiene. We've seen that these measures truly work and are effective in minimizing the spread of COVID-19. This week, officials began to indicate that a vaccine could be ready as soon as November 1st. There's a few companies who have entered now phase 3 clinical trials. Many have called this a political move by the president to secure a victory 2 nights later on November 3rd. Governor Andrew Cuomo, governor of the state of New York, has already responded to the federal government's request for states to submit plans for distribution by saying any vaccine will first be vetted by the New York State Department of Health. A national vaccine strategy has not been confirmed as of yet. This week, New York State took action to make requesting an absentee ballot easy through a new online portal. I will include the link in my email for all those who wish to share and or use the portal. September 30th will be the last day to respond to the 2020 census. Please continue to remind clients, family and friends, neighbors to take the census. An accurate count is so important right now. Officials have confirmed that the California wildfires were started by a gender reveal party. The state is pleading with individuals to be sensible and smart when hosting gender reveal parties, as this is not the first to cause a massive wildfire in this nation and in the world. Last Thursday, you may have heard national news broke about a possible cover-up involving the Rochester, New York Police Department. On March 23rd, Daniel Perdue was placed into police custody after his family called 911 to seek help for their brother, who was struggling with his mental health. Upon the police arriving, a near-naked Perdue was taken outside in handcuffs, where he was laid in the street, when a few moments later, he had a spit hood placed over his head. Upon the spit hood being placed and Perdue being forced into the concrete, he became unresponsive and medics were requested to perform CPR. Perdue died 7 days later on March 30th in police custody. The story was first reported after the family decided to share their story at a press briefing on Wednesday. Wednesday night saw groups of protesters gathering, demanding answers as to why the public was just learning about this incident. When speaking with media, Rochester's mayor disclosed that she initially was told that Perdue died of an overdose until mid-August, when she learned more details about the encounter and in fact learned how Perdue actually died, according to the autopsy reports. Currently, an investigation has been launched and protests have caught the attention of President Trump, who tweeted about his disdain for Cuomo and de Blasio, along with the mayor of Rochester. Early protests resulted in stores being looted, protesters being barricaded in churches, canine units being released, and tear gas along with rubber pellets being used against peaceful protesters. I will continue to monitor the situation and keep you informed as we learn more. Thank you always for taking the time to tune in. If I could provide any updates or answer any questions, please do not hesitate to reach out. I hope everyone has a great week. Thanks.